So a big concern that I do have personally is taking antidepressants while receiving TMS care. Is there any concerns with the combination of the two?
I would say, after all these years, I would say no. I am not that concerned. When we have people that refer from the outside and their providers, you don't have to see us for your total care. I tell people use us like a buffet. So there are some med providers they send to us, or therapists that send to us, and they still keep their care. What we do is just coordinate. We coordinate them like, hey, when are those med changes? What's going on? Here we are at the processes with the PHQ-9, the HAM-D, the GAD-7. These are what we're kind of seeing with the patient. So keeping that communication going on with that primary prescriber is very, very important. Now, when it's internal, they're very easy to do, right? But for those outside providers, I think that there's a lot of TMS providers out there that they, fire and forget versus, hey, no, this is their primary provider. We have to coordinate care with them. And so to me, I would say, what are those med changes going to be? And then we talk about it, and never to, we acquiesce to what the primary provider is. We just want them to have all the information in front of them. So to me, a lot of the things are going to be like the benzos or some of the stimulants, right? And so when we're talking about some of the controlled substances, that's when I might just educate a little bit more on here are some interactions with TMS. But otherwise, I don't really see Effexors, Cymbalta, Prozac interfering with TMS or its efficacy. If anything, the great thing is we start to taper as we start to get down.
And that's, again, my thing too, is like reducing the meds as we're going through. It to me seems so important, right?
Well, I mean, my main
obviously
goal.
There's people that can't do it and aren't going to be able to do those things, but in general, that's the real goal of this, right?
Well, the real goal for me is change the behavioral system care. I really want the patient to get better, in that whole sense. And so if it's on minimal meds, less meds, no meds, that's all a win to me, right?
Yeah.
Is their life better on less of these medications, whether it's the less dosage or less number, or of course it's a total like yay whenever they're off all of them, right? And I have done that, so many times where people are off meds completely, and it's just incredible.
Hey guys, if you found that video informational, want to see more, do me a favor, click this video right here while I enjoy my TMS sessions. Did you click it? Click it already. TMS, it's life-changing. This video right here is going to help you.